Well, first of all, I want to thank you very much for the invitation and the opportunity to be part of the EuroPCR 2021. Well, these are my disclosures, and these are the points I want to cover within the next minutes. But before we start to talk about the technical innovations of the PASCAL device, I just want to remind ourselves why we actually have to talk about innovations in the field of edge-to-edge repair, despite we have more than 10 years of experience. And what we learned from this 10 years of experience, the first learning is that leaving the patient with an acceptable result is not a perfect result. And we learned that we definitely should reach out for a MR reduction of a level of 0 or at least 1+. What we also learned from these 10 years of experience is that leaving a patient with a too small residual valve opening area will hardly translate into a benefit for our patient. And the same is with the mean pressure gradient that often comes along with a too small residual valve opening area. And I think 5 millimeter mercury as a threshold we should definitely respect, especially in patients with atrial fibrillation. And finally, technical success and procedure safety remains the cornerstone of successful edge-to-edge repair. And this is basically a learning from MITRA FR, and especially when we compare the results of MITRA FR to the co-opt data. Well, the PASCAL technology entered the European market 2019 with a claim to address all these landmarks and to make edge-to-edge repair more effective and safer. And 4 novel aspects were added to the well-known principle of edge-to-edge repair, and I will comment on them later on. And last year, a second size of the PASCAL device, the PASCAL Ace, became available. And this second device perfectly complements the existing PASCAL 10 platform, since it has a narrow profile, flat shoulders, a flatter spacer, and makes it an ideal candidate for anatomies and circumstances where the PASCAL 10 might not be a suitable candidate. Well, the central spacer was designed to reduce the stress on the leaflets and to fill the regurgitant orifice between the leaflets. But by doing this, the spacer addresses more or less all of the aforementioned key aspects of a successful edge-to-edge repair, because it maintains an even increased diastolic valve opening area. It avoids thus a development of high gradients, and finally effectively closes the insufficiency gap. The second mechanism, or the second feature, the independent clasping mechanism, is not only a feature for overcoming difficult anatomical circumstances, like we see this in this echo movie from a patient we treated with a very complex tricuspid disease and a congenital heart disease. But more than this, we learned that optimizing the leaflet capture through independent grasping improves our results. And this is, first of all, a mechanism that increases the efficacy of reducing residual MR with the PASCAL device. And since the retention features of the PASCAL are aligned parallel to the collagen fibers of the leaflet, this maneuver can be done again and again without the risk of laceration of the leaflet, even in very old patients. Another important safety feature is the capability to elongate the whole device, thus creating a flat, nearly a straight profile, what helps you to get out of entanglement with chordia. As you can see in this fluoro loop of a patient we treated with a very medial pathology, and we tangled up time and again. And it was just easy to straighten the PASCAL, pull it back and start again, and without the risk of injuring the tissue. And this aspect of safe and atraumatic maneuvering that comes along with a smooth woven nitinol design of the device that applies passive constant closing forces using some kind of a memory of shape principle to avoid damage of the tissue. And this is an important learning, avoiding deformation of anatomical structures. And the latter aspect might be a reason why the MR reduction after release of the PASCAL device from the delivery system maintains at least stable, or empirically even improves. And since anatomical structures cannot be distorted with this smooth device, and this was a key learning during my early phase of experience with the PASCAL technology. So we can see that the PASCAL actually addresses all the aforementioned aspects that determine prognosis and benefit after edge-to-edge repair. And the latest innovation, I just want to comment on this during this little movie is a new stabilizer system, the so-called SRS system. This uses a rail-based mechanism to stabilize the flexible system on the one hand, but maintains the flexibility of the PASCAL device on the other hand. And especially the latter aspect, the flexibility of the system, is a real game changer from my point of view. When you learn to understand, especially when you switch from one technology to another, that this flexible steering mechanism and device properties saves you from placing it where it should simply not be. And that is a great tool to obtain convincing and long-term, short and long-term results, and especially to have a safe procedure. Well, to date, we have just limited data from prospective clinical trials. And when we take a look into the 2-year follow-up of the CLASP study, what was the first prospective single-arm study, there are 48 patients available for 2-year follow-up. And we can see that the long-term survival, as well as heart failure endpoints, and are at least comparable to other clinical trials in the field, and that the sustained reduction of MR over time is accompanied by a favorable remodeling, left ventricular remodeling, and sustained improvement in New York Heart Failure Association functional class over the time. Well, these are the only prospective data to date, and the upcoming data from the CLASP to D to F trial and the MyCLASP registry will give a very more comprehensive insight into this new technology. When we look on what is happening in the real world and take a look in this industrial data set from Edwards Life Sciences that consists of report of all the proctors in the field who document the key characteristics of procedures, anatomical circumstances and outcomes, acute outcomes, we see that there are more than 2,000 data sets are available at the moment. When I first commented on this data set, there were just 1,000 patients available. In the meantime, it's more than 2,000, so it's very big data. And what is obvious on first sight is that even in the very early phase of this device in the field, the majority of cases ends up with an acute MR reduction of 0 or 1 plus, a perfect result in 3/4 of the cases, and nearly 100% to a level of at least 2 plus. And this stratification to different etiologies and endpoints shows that it takes just a relatively short learning curve from approximately 25 cases to decrease procedure time and to improve your results so that you can end up at your center with an MR reduction to 0 or 1 plus in over 80% of the cases. And while this data set is very suggestive, obviously, we definitely see a comparable trend in our own institution where we prospectively evaluate every PASCAL procedure and see a reduction to a 0 or 1 plus result in more than 80% of the cases. And it's important to mention that this is a non-selected data set. So this is an all-comers cohort, and we have a 30-day mortality of 0 at the moment. So a very impressive safety profile. The only available comparison in the literature of PASCAL to the MitraClip technology comes from the colleagues in Bad Oeynhausen in Germany. This is a recently published retrospective comparison of PASCAL versus MitraClip in severe primary MR in patients with prohibitive risk for surgery. And these data suggest that PASCAL might be even more effective in this specific form of DMR. But as I mentioned at the beginning, we still need prospective data from randomized trials to draw a final conclusion, especially when talking about non-inferiority, inferiority, superiority, when comparing the existing systems. But what we can definitely, what can be stated definitely at the moment is that after 2 years of experience, the PASCAL technology is a very safe and effective therapy that addresses more or less all the shortcomings that we've learned in more than 10 years of edge-to-edge repair in the past. A very exciting journey, and maybe we have a little time left for some questions. And thank you once more for the invitation to PCR 2021. Thank you very much.